Well, it's time for Ask the Expert, and right now we have from Bronson, colon and rectal surgery specialists in both Battle Creek and Kalamazoo, Dr. Katherine Kelley. Good morning, Dr. Kelley.
Good morning. How are you doing today, sir?
I am doing great. We're going to talk about a serious issue here, colorectal cancer, which I guess I hear is a lot higher incidence with black people than the rest of the population. Is that right?
That is true. We don't know why exactly. We think there's some sort of predisposition, but also, diet, lifestyle choices also puts them at increased risk.
Obviously, diet can be different. Do you think fried foods figures into that possibly?
Oh, sure. Yeah. I think any diet that's high in fried food or high in fat or high in red meat can increase your risk of colorectal cancer in blacks, white, Hispanic individuals. And so just avoiding those things can be helpful for you.
Are there alternatives when we're frying food that maybe would lower that or make that a little bit more healthy if we still want to cook fried food?
Yeah, my recommendation is you can try to do an air fryer or just do baked food instead of fried food.
So there's a couple ways that we can prevent colorectal cancer. What are some others?
Yeah, the number one thing for most patients is just to start screening for colon cancer at the age of 45. By doing that, you will reduce the likelihood of developing cancer later on in your life.
So what do they do to screen for it? What's the procedure then?
Yeah, it's a colonoscopy. And so what it entails is for one day you have to be pretty close to a toilet because we have to clear out your colon of any stool so that we can see the inside. And then the following day we put you to sleep and we take a good look on the inside of the colon and make sure that we don't find anything concerning.
And I remember I've had them before, and everybody's like talking about how horrible it is, the stuff you have to drink, and then you can't eat and all this. I didn't find it to be that bad at all, but what changes have come up in the last few years?
Right now, we do have a prep that's a little bit lower volume than the old prep, and so if you like Gatorade, you just have to drink 2 big bottles of Gatorade and just stick to broth and Jell-O for a day, and that usually will do it.
Excellent. Is there a certain age, though? You mentioned 45, but is it the same with everybody? And what about as we get older with frequency of testing?
Yeah, perfect question. Right now, the recommendation is 45, and that's for both black and whites and Hispanics. And then how often we survey you after that depends on if we find anything. But we typically keep screening people until the ages of 75 to 85, depending on how healthy you are.
Yeah, and what they find, like when I was screened, they found a couple of pockets in my colon, and so they like to keep an eye on that. But, if nothing shows up, well, then what's the recommendation?
Yeah, then the recommendation, we do it every 10 years. So, it's not that frequent of a test, but it could save your life, and so I strongly encourage people to do it.
Yeah, and as somebody who has had a couple of them, it's really no big deal at all. And so it's nothing to be, afraid of, and it might save your life, for heaven's sakes. Exactly. So what should people do if they're a little concerned? Maybe they're due for a colorectal cancer screening. They've never had one, or they have some more questions about it.
Yeah, they can absolutely talk to any one of their physicians that they see, whether it's their primary care provider or any other subspecialty, about the need for screening, or if they have any other symptoms that are alarming to them, they can talk with their primary doctor about it. And then here at Bronson, a referral will be made so that you can be connected with a physician who will do a colonoscopy.
Dr. Katherine Kelley, a Bronson physician at Bronson Colon and Rectal Surgery Specialist in Battle Creek and Kalamazoo. Thanks so much for joining us today.
Thanks for having me, Tim. I appreciate it.